Have you ever had really sharp searing pain in your urethra? Or maybe you feel like there's a drop of urine stuck in your urethra that won't come out? Well, urethral pain can happen in some IC patients, not all of them. It has certainly happened with me, and it certainly gives you a moment of, ow, what the heck is this? Well, I'm going to go over the potential causes of urethral pain as well as some of the things that you might be able to do to treat it. So the first thing we think about with urethral pain is just trauma, physical trauma. If you've been catheterized, if you're having bladder installations, anytime you put something up your urethra, you're going to stretch that tissue and it's going to become much more uncomfortable. It's quite normal to experience 1 to 2 days of urethral discomfort upon urination after you've been catheterized, usually no sweat, nothing to worry about. But if it's very consistent and persistent, you want to make sure your doctor, number one, is using a low friction catheter. These are catheters that are moist on the outside, so they slide really easily in and out, as well as potentially a small catheter like a pediatric catheter. Those will all minimize trauma to the urethra whenever you have a catheter placed. The second thing we're going to look for in urethral irritation is actual infection, UTI. Especially if it's come on suddenly, especially if you have a fever, if you have chills. It's very, very important that you screen for UTI. And you can actually buy a home UTI test kit at most drug offices where you pee on a stick and let's see if it shows any signs of infection. If it does, call your doctor. But if this does not resolve, call your doctor anyway. Make sure you let them know you're having very bad urethral pain so that they can do a proper diagnostic workup to try to figure out what's going on there. The third thing we're going to look for is dryness and estrogen atrophy. So when I was about 52, yes, I'm older now, I cannot believe it, I started struggling with a really weird urethral symptom. It felt like there was a drop of urine stuck in my urethra that would not come out. And listen, my IC self-help skills are really good, right? I threw everything I knew at this symptom and nothing made it better. So I finally threw myself on the mercy of my doctor, my urologist, and said, help me, what is this? It's making me crazy. Well, he took one look and he goes, Jill. And I'm like, what? What'd I do? What'd I do? He goes, didn't you use the estrogen cream I prescribed for you last year? And I very meekly went, no. And he goes, why? And I said, because of my brain, I'm 25 years old and I can't possibly have an age-related issue, which is the truth. And I'm older now and I still feel that way. And he explained to me that the urethra is kind of the canary in the coal mine when it comes to estrogen atrophy. And it's often the first part of the urinary tract that starts to really kind of be very uncomfortable as tissues dry out with estrogen loss. So what's the treatment? Estrogen, topical estrogen. And what he gave me again was another prescription for topical estrogen. And he instructed me to rub a little bit of estrogen cream right at the entrance of my urethra. And it worked. Within 2 weeks, my urethral pain was gone. And if I forget to use my estrogen for a couple of weeks, it starts to come back. So I'm very, very invested in wanting to keep my skin as healthy as I can. Now, the fourth thing we're going to look at for urethral pain is actually an infection of the prostate gland in men or the periurethral gland in women. They're both essentially what we call homologs. They're almost identical in tissue and structure. And so, yes, women, you have a prostate. We call it a periurethral gland. And like the male prostate, the drainage ducts are very tiny and easily get blocked if infection is present. So they basically become kind of like deep, painful pimples. So it's very easy to determine if you have an infected gland simply by washing your hands really well, maybe putting on a glove, a little bit of KY, and you can actually insert your finger in your vagina and just rub on the front side about an inch. And if you feel any tender lumps, feel like a deep pimple, that's an infected gland. You'll need to call the doctor and they're going to need to develop a treatment plan for that. The fifth thing we're going to look at with urethral pain is pelvic floor tension. So you have 3 layers of pelvic floor muscles in your pelvic cavity, and they kind of match the knuckles on your fingers, right? And so at the shallowest level, right above the skin, you've got muscles called the levator ani, and they happen to wrap around the urethra. And so when these muscles get tight, what do? They start squeezing the urethra. They start restricting blood supply to the urethra. So if you notice you can't start your urine stream right away, that you're hesitating 5, 10, 15, 20 seconds before you can relax enough to release urine, we want to get your muscles checked. Let's make sure you're not dealing with pelvic floor muscle dysfunction, because that's completely treatable with pelvic floor physical therapy. Now, the sixth thing that we're going to look at for constant chronic urethral pain is chemical irritation, especially in patients who seem to be more sensitive, if you have sensitive skin or if you have estrogen atrophy. If I put on a pair of underwear washed in sheer or tied, within 5 minutes or 10 minutes, I'll have urethral pain. Why? Because I'm a redhead and my skin is super, super sensitive. So we want to make sure that your sensitive skin is not being provoked by certain chemicals, from a spermicide to a latex condom to soaps, bubble baths, toilet wipes, fabric softeners. Any of these chemicals can irritate that skin and irritate and trigger our more sensitive nervous system. And so it's very important that you not use bubble baths, that you not use any harsh soaps like Irish Spring, Dial, things like that. A plain Dove bar is perfect to use down there when you tend to be a little bit more sensitive. Also, be very careful with fabric softeners, dryer sheets, anything like that, which I always recommend using a free and clear laundry detergent and absolutely no fabric softener at all. And when in doubt, rinse your underwear out twice to get rid of any chemical residue. And then last but not least, this might actually surprise some people, but do you wear mini pads every day? And I usually, when patients are on the phone, I say, why? Do you leak? And most patients say no. And then it's like, then why are you wearing a mini pad? Just in case I might leak. Well, the problem with very, very thin pads is that they use a layer of chemicals to absorb any fluid. And when the chemicals get wet, they off-gas irritants. And so it's quite common to see women who have vulvar irritation in the shape of a mini pad. And that has happened to me. I can remember that there was one brand of mini pad I used to wear. I don't wear mini pads anymore, but I used to wear them. And I could always tell when I opened the box if they were safe or not, because sometimes the box had a very harsh glue smell. And I knew if that was the case, I could not use them, and I usually return them. So if you're struggling with long-term urethral irritation, consider the mini pad you might be wearing. That could easily be a source of a chemical that's irritating that sensitive skin. If you're looking for more information, come on over to the IC Network website.
One last point, because I've been there. I developed significant urethral symptoms at the age of 51. It felt like there was a drop of urine stuck in my urethra, which became very irritated over time. My urologist explained that the urethra is often the first part of the urinary tract that changes with aging. He had prescribed estrogen cream a year earlier, but I didn't use it because I didn't understand the importance of it. I was given a new prescription for estrogen cream, and within 2 weeks, my symptoms resolved. My goal is to keep my skin as healthy, moist, and strong as possible. I use Dove soap for sensitive skin, 7th generation free and clear laundry detergent, with no fabric softeners, dryer sheets, or scented mini pads or douches. If or when sitting is painful, I use special chair cushions that reduce pressure on the urethra, vulva, and rectum. You can find these in the ICN shop at icnshop.com. Take-home summary. The urethra is a tube that drains urine from the bladder. Urethral pain can be very sharp, like being poked with a pin. It can also feel as if a drop of urine is stuck in the urethra and won't come out. Urethral trauma from a catheter or cystoscope can cause urethral pain. It usually lasts just 1 or 2 days. Bladder infection can cause urethral pain. Check your urine with a UTI dipstick. Dryness from estrogen atrophy can cause urethral pain. Topical estrogen is the option. Infected glands can cause urethral pain, and they often feel like a painful pimple. Tight pelvic floor muscles can squeeze the urethra and make urination difficult. Soaps, bubble baths, latex condoms, spermicides, laundry detergents, and fabric softeners can irritate both the urethra and the vulva. Rinse with water. Wearing mini pads can trigger skin and urethral irritation due to the chemical used which absorb fluid. Avoid all scented products. Now, questions you can ask your doctor. How can we reduce urethral trauma after bladder installations or using a catheter? Can you use a smaller catheter or a low friction catheter? Can you use a numbing gel such as lidocaine? Could my urethral pain be caused by a bladder infection? Are there any swollen glands that could be playing a role in my pain? Am I showing signs of estrogen atrophy? If yes, would you prescribe a topical estrogen cream? Where should I put the cream? At the entrance to the urethra, the vagina, or both? Are my pelvic floor muscles tight? Does it look like my skin is irritated and or inflamed? And what can I do to reduce my urethral pain? And would a compounded cream be helpful, such as an estrogen, lidocaine, or baclofen, or ketamine, or any combination thereof? I invite you to our live weekly IC support group meetings over on Facebook, YouTube, every Sunday, 1 p.m. Pacific. Of course, you can find the best resources, books, chair cushions, heating pads in the IC Network shop. And if you find this video helpful, please become a member of the IC Network and you can get our wonderful magazine, the IC Optimist. Thanks for watching.